So guys, in this video we are going to talk about surgical approach for aneurysm. So the today's topic is aneurysm surgically. So before starting the surgical approach, and when we do surgery for if the patient is having aneurysm, we will take a sneak peek into the aneurysm. What is aneurysm? So guys, basically aneurysm is the abnormal dilatation and this dilatation is permanent. So the aneurysm is the abnormal localized dilatation in any segment of artery. Major arteries most probably, or it can be in the small arteries also, minor arteries. So what is the definition of aneurysm? Aneurysm is the abnormal dilatation which is localized to some segment of the artery. It is a kind of bulging out from the normal wall of the artery, and that is called as a aneurysm. So guys, this bulging, this pouching can be of any size. It can be from 1 centimeter to the 5 to 7 centimeter. So what is the limit after which we call it as an aneurysm? So guys, if the aneurysm or the bulging or the dilatation is more than 1.5 centimeter than normal diameter, then it is called as an aneurysm. And if it is less than 1.5 centimeter than normal diameter, then it is called as a ectasia. Please try to remember this word. It is called as a ectasia. If it is less than 1.5 centimeter than the normal diameter, it will be called as a ectasia. So guys, we saw the definition of aneurysm and how when it is called as a aneurysm. So now we'll take a little bit review about the types of aneurysm according to its layer involvement of the artery. So basically there are two types of aneurysm, and those two types are true and the false aneurysm. In true aneurysm, all the three layers will be involved. In false aneurysm, only one layer will be involved. And guys, this false aneurysm most commonly caused by trauma, and this is very emergency situation. We have to operate it. So the gold standard treatment for this will be the surgery, or we can do a USG guided compression. So if the person is having any false aneurysm, then we'll have to operate it immediately. Otherwise, we have to do some USG guided compression. And if the person is having true aneurysm, then there can be two possibility. Either it can be more than some limits, which is indication for surgery, or it can be less than that limit. Then we'll go for conservative treatment. So just suppose we will take an example of aorta over here. Just suppose the size of normal aorta, not suppose, but actually the size of normal aorta is 3 centimeter. in some people it can vary. If the person is very tall and very thin, then there will be size of aorta accordingly. If the person is very obese, then there will be size of aorta accordingly. But we can assume that, or we can say that, on an average the size of aorta is 3 centimeter. And if the person is having aneurysm which is asymptomatic, if the person is having aneurysm which is asymptomatic, and if that asymptomatic person is having aneurysm with diameter more than 5.5 centimeter, then we will definitely do surgery. But if the person is having diameter less than 5.5 centimeter, then we will do ultrasonography, we will do CT, and we will follow the wait and watch approach till next 6 months. After 6 months, if the size of aneurysm increase or go above the 5.5 centimeter, then we will go for surgery. But if the size of aneurysm remains 5.5 or maybe around 5.5, then we will again wait for the next 6 months. But this time we will look for the increment in the size of aorta. If the size increase more than 0.5 centimeter in next 6 months, then we will do surgery. If size not increase more than 0.5 centimeter in next 6 months, then we will once again do the wait and watch approach. We'll once again do USG, CT, and we will keep the patient on the follow-up. So this is a basic rough idea. If the asymptomatic patient is coming and the size of aorta is more than 5.5 centimeter, then we will do surgery. If the size of aorta is less than 5.5 centimeter, then we will follow our wait and watch approach. We will wait for 6 months, and after 6 months, if the size of aorta is increasing more than 5.5 centimeter, we will do surgery. If the size remains 5.5 centimeter, once again we will wait for 6 more months. We will wait till the size increase more than 5.5. So this is the basic approach, how we proceed till surgery. What is the indication for surgery? And there is other possibility apart from this asymptomatic, and that is rupture. Now there is also a two type of possibility in aortic rupture. Either it can be retroperitoneal or it can be intraperitoneal, but most probably, that is 80%, it will be retroperitoneal. Chances are more in retroperitoneal, and 20% chances are there for intraperitoneal. In intraperitoneal, there is a triad for abdominal aorta rupture. Sorry for this spelling mistake. And this triad is abdominal pain, shock due to hypovolemic shock, this will be hypovolemic shock, and the pulsatile movement or pulse on the abdominal region. So this is the triad for intraperitoneal aortic aneurysm rupture. So guys, we saw the basic peak that how we will move forward, or how we will say that this is intraperitoneal or this is retroperitoneal rupture of aortic aneurysm. So now, before we go to the actual surgical treatment, we will look for the investigation of choice. So guys, for aortic aneurysm or general aneurysm, investigation of choice we are having is ultrasonography. We can see the size to assess the diameter of the aneurysm. We will do ultrasonography. But guys, you have to remember this, that ultrasonography just show the aneurysm, but it can't show the rupture of aneurysm. So that is a drawback over here. But not rupture. To confirm this rupture, we'll do the CT scan. And then before going for the surgery, we'll do some fitness test and other test to rule out some other diseases. In fitness test, we'll do ECG, chest X-ray, CBC, and all this normal tests, urine test, clotting factor test, clotting factor studies. And guys, one more thing you have to remember, and that I want to tell you in particular, that is we don't do angiography over here, because there is no use of angiography in this. If patient is having other indication or other symptoms which can lead us to some other things like atherosclerosis of coronary artery or something, we can do angiography. But for aortic or any aneurysm, we don't do angiography. And the reason is, in angiography we can see only the lumen or the cavity of aorta. Only lumen is visible. But in here, in the aneurysm, we can't we can't go deep into the aneurysm, into that bulging, into that pouch. We can't go inside. There is a possibility of clot also at the site. So because of all this, we don't do any angiography in the aortic aneurysm. Now we will go for treatment, that is how we surgically approach the aneurysm patient. Basically, before the indication, before the size increase above the risk level, we do conservative treatment, that is the stopping of smoking and all this, hypertension control, secondary diseases control, all the risk factors which can lead us to the surgical failure, will control all these other things. After that, if there is a clear indication that will need the surgery, then we are having many options. Before that, we can do a compression therapy. This is ultrasound probe guided compression therapy. In this, basically we do compression of aneurysm for 30 to 40 minutes and followed by a CT scan till the next day. So we see our successful of this compression and everything. After that, we can give thrombin injection. This is also ultrasound guided. After that, in some in some artery aneurysm, we can do bypass also. some small arteries like popliteal artery. We can do ligation of the artery. For example, in internal iliac artery, we can do ligation if there is aneurysm of internal iliac artery. Or else we can do open repair and endovascular repair. This is two main surgical procedure in aneurysm. So there is open repair and endovascular repair. In open repair, we will open the abdominal part by wide incision, and then we will repair the affected part of aorta by putting some stent or grafting. So that is called as a open repair. We'll do wide incision in abdomen, then stenting, grafting. This graft and stentings are called as a inlay, Dacron grafting, or wide Dacron. In endovascular repair, basically we go through the femoral arteries. We go through the both femoral arteries or groin areas to the affected part, and we will keep some stent and some graft over there. It is kind of we won't do any big incision like we did in the open repair. In the abdomen we did big incision, we open the abdomen and then we repair the abdominal aorta, while in this endovascular repair, it is also called as a EVAR, we enter into this aneurysm through the groin area, then we repair over there and we do the surgical treatment. So guys, this was a sneak peek into the surgical treatment of aneurysm. So before closing this topic, before finishing this topic, I would like to tell you about some points like indication for surgery, the size of any artery, how much when it is indicated for surgery. Just suppose if it is an abdominal aorta, then the size will be 5.5 centimeter will be the indication of surgery. If it is an iliac artery, 3.5 centimeter. If it is a popliteal artery, 2.5 centimeter. And if it is a femoral artery, 2 centimeter. So this is basically indication for the surgery. The size of aneurysm for the indication of surgery. And one more thing you guys should remember, because this is very mostly commonly asked questions, that most commonly affected artery in the aneurysm is, so guys, the answer will be aorta. Most common peripheral artery affected by aneurysm is popliteal. Here is a little bit difference. They change just question that most common peripheral artery, and we always remember that, oh my god, it is the aorta. So you just did one more question wrong. Don't panic. Just remember this. Most common peripheral, it is popliteal, and most common artery, it is aorta. And then last point is most common visceral artery, then it is splenic. So guys, this is the study about our aneurysm. We studied about the little bit definition of aneurysm. If it is if the size of aneurysm is more than 1.5 centimeter, then it is called as a aneurysm. If it is less than 1.5 centimeter, then it is called as a ectasia. Then we studied about little bit structure of according to shape, the types of aneurysm, like pseudoaneurysm and true aneurysm. In pseudoaneurysm, we do surgery, that is the gold standard for the pseudoaneurysm. Then for the true aneurysm, we will wait and we will watch till the size go to the alarming level. So this is all about the aneurysm surgically. Thank you guys, thank you for watching this video, and we'll meet in the next video. Thank you, bye bye.